Before we get started, let's test your back or sciatic pain by moving around and sensing your range of motion and pain. Try to find some movement that consistently irritates your back or sciatic pain. If it's bending over, then make a note of how far you need to bend over to have pain. If it's sitting, then jot down how many minutes you can sit before pain begins. Always have a good idea of your pain on a pain scale of 0 to 10. 10 meaning pain where you feel you need to go to an emergency room. Make a note of that on a pad of paper or your computer right now, and we'll retest at the end of this session to see if your pain is improved. All of the exercises in this program are meant to be gentle. Some discomfort is acceptable, but you shouldn't have much. If you're grimacing, tensing, or holding your breath when doing an exercise, you're working too hard. Tone it down. Modify it to fit where you are now. Don't worry, you'll improve with practice. You should feel better during and after all exercises. Some things you might need for this video are an exercise band, possibly ankle weights or light dumbbells, a massage table, a mobilization strap, pillows, Coverroll stretch tape, and Leukotape P. Links to these products are on my website, or you can look for them in stores. Let's get started with somatics warm-ups. This is the back arch exercise meant to relax your back muscles. You can do this sitting or standing. Inhale, arch the spine, open up your palms, lift your head, and feel the contraction along the whole back. And then exhale to relax your spine, allowing it to flex forward, and rest your weight on your arms if you're sitting and on your legs if you're standing. Your back should feel comfortable and nice and stretched out here. It should feel like a really good position. Your head is down and relaxed completely. From here, you're going to articulate your spine one vertebrae at a time, starting at the base of the spine. Use your hands to help you if you need to, and definitely use your legs to help you if you're standing. Come one vertebrae at a time, back up. And then your head is the last thing to come up. Be sure that you don't arch your spine when you lift your head. Keep your spine relaxed instead. Here we go, let's do it again. Inhale, arching the spine, palms forward, head up, big contraction back there. Exhale, relax the spine as it flexes forward and your weight bearing through your arms on your legs. Head drops at the very bottom. Articulate your spine one vertebrae at a time, starting at the base. Use your arms and legs to help you come back up. Feel each vertebrae stacking on top of the other. The head is the last item to come up, and when you come up, be sure not to arch your spine to bring that head up. Okay, one more time. Inhale, arching the spine. Exhale, flattening the spine to relax it. Allow it to flex. It should feel like a nice stretch here. Inhale, exhale, articulate your spine one vertebrae at a time to come back up. Use your arms and your legs to help you. One vertebrae at a time, keep breathing. Your head is the last thing to come up, and you finish in a tall, relaxed spine with your knees soft if you're standing and your back relaxed. This is the side lying waist release. It's meant to relax the muscles in your waist area. So all you're going to do, you can do this on your bed or on the floor. You're going to lie down on your side, and your head is going to rest on your shoulder here. Now, if you're uncomfortable doing that, feel free to put a pillow or something underneath your head. All right, so the hips will be bent at about 90 degrees here, and then we want the knees to be bent at about 90 degrees too. All right, your hand is going to be on the other side of your head, lightly touching your ear. And you're going to start in this resting position. You're going to inhale, and you're going to lift your foot and your head up, and your hand is protecting your neck by holding your head. And you'll feel these waist muscles contracting here. Inhale, feel that contraction, then exhale and lengthen. Really stretch out that top rib cage. Stretch, 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 and then relax. Now, when you relax this top knee down, we want to make sure that this bottom foot is supporting it. We don't want that knee to go all the way to the floor because that's kind of uncomfortable. So make sure you position that foot underneath there, and now relax. Good. Okay, let's go again. Inhale to contract those waist muscles.
Exhale and lengthen, lengthen, lengthen. Stretch, stretch, stretch. It should feel really good to do. And then relax down. Once more. Inhale to contract the waist muscles. Exhale to lengthen the waist muscles. Stretch, stretch, stretch. And relax. Good. Now let's hit the other side.
So you're gonna lie down on your waist. Either rest your head on your arm or on a pillow if you like. Hips are roughly bent at 90 degrees, knees are at 90 degrees. Hand is on the other side of your head. Inhale to lift and feel these waist muscles contracting. Feel that contraction and now lengthen and stretch, 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 and then relax. Let that knee fall to the other foot. Good. Let's try it again. Inhale, feel the contraction. Exhale and lengthen, lengthen, stretch, and relax. Once more. Inhale to contract. Exhale to lengthen and relax. Good. Try that out. Here's a hamstring stretch. I like to do my hamstring stretches with a single leg instead of double legs. I recommend that you find a couch or a table that you can sit on, maybe your bed, that you can put one leg up and the other leg on the floor. So whatever leg is up, we want that hand behind. So I've got my left leg up now. I'm gonna put my left hand behind my back here. My hand is supporting my back so I'm not straining myself, and it's helping me lift and lean forward. We do not want to reach toes like this because that then strains the back. So use that hand instead to lift and go forward. Now I've got a nice hamstring stretch. We're going to hold this for 5 or 6 breaths. If you want to add to this stretch, you can pull the toes back towards you, and that will add the calf in here. However, those of you with sciatic pain, you might find that this irritates that sciatic nerve. So don't be too aggressive with this. We're just looking for a comfortable, relaxing stretch rather than an aggressive stretch. You'll get the motion and range that you need. Don't worry. There's no reason to rush it. So let's just do 1 or 2 more breaths. We're looking for feeling the muscles behind the thigh stretching. You might feel it behind your knee. You might feel it in your calf too. And now I'm going to switch. So we're going to go to the other side. I'm going to put my right leg up. I'm going to put my right hand behind me to support my back. And we're going to start breathing. If your knee can't get down, don't worry. If the knee is bent and you still feel a stretch here, it's okay. Don't worry about it. Just feel the stretch. Let it happen. I'm going to pull my toe back to get my calf in here too, because I like that feeling. Okay, that's about 5 breaths. We're going to switch sides again. Left leg up, left hand back, lift your chest, hinge forward at the hip joint. I'm going to pull my toe back again because I like that. Don't strain yourself, just relax with it. It should be a comfortable, relaxing stretch, not one that you're fighting. This is not a competition. Okay, let's get the last leg. One more time. Right leg up, right hand back, lifting your chest, hinging forward at the hip joint, whatever you're comfortable with. Should be no back pain with this. I'm going to go ahead and pull my toes back to include my calf a little bit. Nice job. This is a standing hip strengthening exercise. It's good for developing balance and strengthening your hips. Now, because it involves balance, there's going to be 3 levels to this, and you need to choose which one is most appropriate for you. Level 1, people, we will just want you to be standing on one leg, and I'll want you to be either in a doorway or next to a wall or having a chair next to you. If you're standing on the left leg, I want you to fix your balance by falling to the left hand to fix it. So if you're going to fall out to this, you need to fall out to the side here. I do not want you to fall to the inside. All right, so use this left hand to fix your balance. And if you're on the right leg, you'll use your right hand to fix your balance. That's level 1. Level 2 will be the same thing, except now you're going to be moving the opposite leg out and in. So whatever level's right for you there. And then level 3 will be using some resistance. So we're going to use an exercise tube. You're going to put the tube underneath your foot, close to where the heel meets the arch here. So that's where we want it. Both feet are going to step on that tube. You're going to hold the tube up like this, and let's begin. Whatever level you are, we're going to do 15 reps if you're moving that leg. 5, 6, 7, 8, 11, 12, 13, 14, 15. Now we're going to switch legs. All right, so while we're doing this, I want to make sure that the leg that you're standing on, the knee is soft while you're doing this. Do not let that knee lock. We don't want the shoulders to come way out like this, and we don't want the hips to come way out like this either. We want to be lined up like I am now. "13, 14, 15, switch. We're going to do 3 times on each leg. 1, 13, 14, 15, switch. 13, 14, 15, switch. Last set. My left knee is soft, my body is tall, my chest is lifted. 13, 14, 15, switch. 13, 14, 15, and you're done. This is the thigh stretch. It's best done on a massage table because it's a nice firm surface. If you don't have a massage table, then you can do it on your dining room table or your kitchen countertop or even the top of your stairs. At the very worst, you can do it on your bed, but a bed is generally too soft and you won't get the stretch that you really need. So as a last resort, you can do it on your bed. So basically, what we want to do is we want to sit close to the edge of the table that you're using. And we're going to lie back with both knees to your chest. Now, some of you might feel uncomfortable with your head without a pillow. Feel free, in fact, I recommend it. Please put a pillow underneath your head. It will actually help you with this exercise. So keep a pillow underneath there. I'm hugging both knees to my chest, and that should feel great for my back. I'm letting it stretch out and calm down. Okay, so what we're going to do now is we're going to hold on to just one knee and keep that knee close to your chest while you lower the other one. Now you'll notice that I've got a chair here at the edge of the table here. What I have found is there are people whose legs are too heavy for them to control. And having a chair there, now the chair is holding up the leg instead of you. So this can really help out with this stretch, especially if you're having pain while doing the stretch. It's probably because you're straining because your leg is too heavy. So put a chair there or a box or something. You'll notice that my heel is up. So I'm going to control the stretch by lowering my heel down. And now I've got the stretch I'm looking for without straining my back. So we're going to hold each stretch for about 5 or 6 breaths. Let's say this has been about 3 or 4 breaths right now. So we'll do one more. And just like gravity, do its thing, pulling that thigh down and stretching the front of your thigh here. Okay, now we're going to switch. I'm going to bring this knee up, I'm going to reset my back, and then I'm going to lower the other leg down. So I'm not going to use the chair on this side. So you can see this is really what we want that leg to do. We want it to be able to rest on the table. And if it's above the table, that's perfectly fine for now. Our goal is eventually it's going to be resting down to the table. And then we're going to hold on to this stretch. Be sure that you're pulling this knee back so it's protecting your back. And then this foot, we want to make sure it's pulled back towards the table too, because we're going to look for about a 90-degree angle in that knee. So I feel a nice stretch there in my thigh right now. I'm breathing through it. And we'll say that that's been about 5 or 6 breaths. Then I'm going to bring this back up. I'm going to do it one more time on each side. Now, before I lower this right leg down, I just want to show you a couple little tricks. If there are some people whose legs aren't heavy enough, and so they need a little bit of extra weight on their ankle to get their leg down. So getting a set of ankle weights can do that for you. This is 5 pounds right now, and this is the max that I would recommend. So we're going to start with our knees up here. You're going to lower this down. I would really recommend 2 to 5 pounds if you need any weights. I'm going to push that chair out of the way so we can let the ankle weights do its thing. And now that's pulling down my leg, and I'm getting a much deeper stretch in my thigh. And I'm going to bend my knee to 90 degrees. So again, we're going to breathe through this for 5 or 6 breaths. One more breath. Let it stretch. I'm going to bring that back up. Now, on the other leg, I'm going to show you one more trick that I like to use. So we're going to take that ankle weight off. And this helps me get a better stretch too. If you have one of these exercise bands, you can get one on Amazon or Walmart or Target or whatever. You put it on the edge of your shoe like that. You bring that down. I'm bringing the strap down and around my shoulder here. And then I'm going to hold on to my other knee like this. And so what that band is doing is it's pulling the foot down and back towards the table for me. And now I get a really great stretch like this. So I'm just going to breathe through this and let the band help me stretch. My right knee here to my chest is protecting my back, so I should be nice and safe. Now we're going to breathe through this, and I want to point out one last thing. A lot of people, when you lower your knees down, you'll notice that your knee is going to the outside like this, and that's perfectly fine. Eventually though, we want that knee to come to the inside in alignment with your hip, because that's where it is when you're walking. However, some people, if they bring their knee in alignment with their hip, it hurts their knee. So you want to start to the outside because now you don't have any knee pain. Don't worry, as you get stretched out, you'll be able to bring that knee back into midline, but that'll be one of your goals too. So there will be 2 goals. One is that the thigh can rest all the way down on the table and that the knee is in alignment with the hip joint while protecting your back with the other leg. This is a butt pump exercise. The glute muscles are really important for hip, knee, and back issues, so let's give it a try. You're just going to come on to your elbows and knees. Now, there's an alternative version where you can stand doing this too. So follow whichever version is good for you. You're going to bring one leg up and just hold it there for a second. And your goal is you must feel this glute pump here, this little butt muscle working right now. If you don't, then rotate that knee to the outside a little bit until you do. You should feel that that is turning on there. Once you feel that, then we begin. We're going to do 30 repetitions. And I want you to feel that that butt muscle is doing all the work. I don't want your hamstring to do it or your back to do it. Get that butt muscle to do it. Now, if you can't make it to 30, that's perfectly okay. Just do what you can. Don't strain yourself. Don't start contorting your body to make this happen. Let's do 5 more. Good, and we're going to bring that down, and we're going to switch legs. Bring the other leg up. Try to feel that butt muscle. If you don't feel it, rotate the knee out. And then we could begin.
Feel your butt doing the work. Don't make your back do it. Don't make your hamstrings do it. Make that butt turn on. That's about 30. Let's go ahead and bring it down. One more time on each leg. Bring that up. If you need to, rotate the knee to the outside to feel that butt muscle working better and start pumping. Now, what a lot of people will end up doing is a motion like this. That is not what we want. We want straight up and down. So be sure you're doing it correctly. If you're doing it correctly, you'll really feel that butt muscle working. Let's do 5 more. 1, 2, 3, 4, 5. Down it goes. Last time on the left side. Bring the leg up. Feel the butt and start pumping. That's 20. 5 more. 1, 2, 3, 4, 5. Down it comes. After this, just sit back and stretch your back out a little bit. And you're done.
This is a stretch for your shoulder girdle, your rib cage, and your waist. It feels really good, so try this out. You're gonna need a doorway. You're gonna put your hand on top of the door frame and it's gonna face away from you like this. Now, if that's too tall for you, you can also do it on a door as well. So here we go, we're gonna put our hand facing away from us here. I'm gonna step my leg through the doorway and I'm gonna lean into that and you'll feel this really nice stretch all the way through the rib cage, shoulder girdle, and waist. It feels delicious. I'm just gonna hold this here for a little bit. And then we're gonna hit the other side now. So I'm gonna put my hand on facing away from me again. I'm gonna step through, drop down and stretch. Now, you can add a little bit of rotation to this if you like. It's up to you. You might find different areas of tightness through your rib cage. Feel free to explore that. And then we come out of it. Nice job. Okay, we're gonna do an all fours rocking stretch. It's great for the back and hips and knees, and even for the neck and shoulders. Here's how we're gonna do it. This can also be done at your desk at work. Now, a lot of people, we're gonna be sitting back on the heels. A lot of people will have a hard time with their ankles like this, so you feel free to put a rolled up towel or pillow there. Or if you're doing this on your bed, you can put your foot at the edge of the bed and let it hang off like that. Here's how we're gonna do it. You're gonna put your hands up here just above shoulder height and then sit back and feel that nice, delicious stretch in your low back. And hopefully you might even feel some in your shoulders and rib cage. Okay, we're gonna come back up out of that. I'm gonna do it one more time and we'll add a little twist to it. So we're gonna rock back like this. This time, we're gonna walk our hands over to one side. And you should feel a nice stretch through the whole rib cage and waist and shoulders on this right side here. And if you can, see if you can breathe into that rib cage to expand it even more. Okay, we're going to walk it over to the other side now. Now, an option that you have for your head, if you find that you're holding up your head or it doesn't feel comfortable here, you can rest your head on your hand like this, or place a pillow there if you like. Again, let's try breathing into that left rib cage now.
And then come back to center.
And up you come. Nice job. This is an exercise to loosen up the hip joint. It helps with hip pain, it can help with knee pain, it can help with sciatic and back pain too. So try this out. Just going to get a belt. This is a mobilization strap. There's a link to this on my website that you can buy from Amazon, or a belt could work too. You're going to put it on the inside of a door handle. You're going to make sure that that door closes securely, and then you're going to put your leg in the strap here. You want to cinch this strap up as high as possible into the groin area. And then what we're going to do is we're going to face away like this. Now, if you've had a hip replacement, you need to run this by your doctor or physical therapist first before doing this exercise. Okay, so here we go. We're just going to lunge forward like this 5 or 10 times, gently. And what that's doing is pulling the hip bone back in the hip socket. Good, and then we're going to turn sideways. And we're going to lunge to the side now, which is pulling the hip bone out this way, and it's stretching the capsule that surrounds the whole hip socket. Good.